Hi, everybody. It's Lisa again, and I have been asked by popular demand to try to do a review for Chapter 2 like I did for Chapter 1, and I would be happy to do that. So, the first thing that we're going to talk about is the structure and organization of the body. And the chapter talks about this. The easiest way to remember that is we have cells. Different types of cells turn into tissues. Different types of tissues then develop into organs. And then those organs go into the body system. So when we look at the different types of cells, there's different parts of the cell. And you can see there's a cell membrane and the nucleus, chromosomes, all different parts of the cell. And the cell is technically the fundamental unit of all living things. There's a number of different types of cells that are out there. There's the muscle cells, there's nerve cells, fat cells, and epithelial cells. When we talk about that, those cells then form different types of tissues. And so when all of our epithelial cells get together, we have epithelial tissue. Then we have muscle cells going into muscle tissue. Connective tissue are developed. And then we have nerve tissues. Okay. When we have those different tissues then going together, we then go into organ development, and different types of tissues combine to form an actual organ. And then what we do is we have those groups of organs that work together to perform complex functions. So it all starts with a cell, it then goes to the tissue, goes to the organs, and then develops body systems. Our bodies are divided into different, our organs are divided into different body cavities. And you'll see here we have the cranial cavity, and we're going to talk about what organs are in each body cavity in a minute. We have the thoracic body cavity. We have the abdominal, the pelvic, and the spinal. Please note the spelling of thoracic. It's one of the big errors that we see. So in the cranial cavity, we have the brain. The thoracic cavity holds the heart and the lungs. In the abdominal cavity, we have the stomach, the small and large intestines, the spleen, and the pancreas. The pelvic cavity houses portions of the small and large intestines, the bladder and the rectum. And then the spinal column actually houses the nerves of the spinal cord. Oops, I just jumped. We also have different regions in the body. We have we have abdominopelvic regions. And that is going to be our hypochondriac region, our epigastric region, our lumbar regions, which are going to be to the side, our umbilical region, which is here, we're in the middle where our umbilical cord is, our inguinal, which again, they'll be on either side, and our hypogastric. So let's look at some of the terms that you've already learned, okay? So this is right here is epigastric. That's going to mean above the stomach. So if you're asked where the epigastric region is, epi is going to be above. So we're going to guess that it's above the stomach. The same thing right here with hypogastric. It is going to be below the stomach area. Okay? In addition to the pelvic regions, we also have quadrants. We have the right upper quadrant, which the abbreviation is RUQ, left upper quadrant, LUQ, right lower quadrant, RLQ, and left lower quadrant, LLQ. So they divide the body simply in quadrants. So here in the right upper quadrant, this is where our liver gallbladder is going to be located. Our left upper quadrant is going to be our pancreas. And so if somebody comes in and says they have right upper quadrant pain, or they have pain, in that area, the physician's going to say that they're going to document that they have right upper quadrant pain. So we need to be aware of where that's located. Okay. Then we have the anatomical divisions of the back. The back is broken up into 5 different categories. The cervical area, the first area of the spine is called the cervical spine. The second part is going to be the thoracic. The third is the lumbar. The fourth is the sacral. And the fifth area is the coccygeal. Now, if you notice here, we have the 1 through 7 is going to be our cervical vertebrae. Our thoracic vertebrae are going to start, and we'll go down to our 12. So we have 1 through 12 in our thoracic. We have 1 through 7 in the cervical. We have 1 through 5 in the lumbar. And then the sacral portion is actually some bones that are fused as well as the coccygeal. This is really important when we're talking about patients who have had issues with areas that they've affected in the spinal cord. So if we get the higher the fracture that we see, the more paralysis that there is. So if we have a patient who has a cervical C3 or 4 fracture, we're going to see paralysis of the pretty much all of the body. If we have a thoracic fracture, it may only be from the waist down. So depending on where the break is, will be depending on the amount of paralysis that there is. For body positions, this is so important. You need to know your body directions. So the front is called anterior, and it's also ventral. Okay, so if you think about that, I always think of, if we look at the front of the body, our breasts make a V. The back is posterior or dorsal. I always think of the dorsal fin of a dolphin. It's on their back. Deep is going to be, again, something that's deeper in the body. Superficial is something close to the surface. Proximal is going to be near the beginning point of a structure or the point of attachment. So the shoulder is more proximal than the elbow. Distal means further away. So the wrist is more distal or further away than the elbow. So it's going to be further away from the point of attachment. Inferior is always going to be below, and superior is going to be above, so towards the head. This just gives you a picture of what it looks like. Again, superior is here, inferior is towards the feet, deep is going to be more deep in the body, superficial is on the outside. We have the anterior or ventral, means the same thing. Posterior dorsal is the back. Proximal is closer to the point of attachment. Distal is further away than from the point of attachment. Some of the other terms that you're going to hear are medial, which means towards the middle. Lateral means towards the outside, so it's going to be toward the to the side. Supine means that we are going to be laying with our back to the exam table. Okay, so we're laying face up. Prone position is when we are laying face down. There are different planes, and I think this is one of the hardest things that students have trouble with, is there are different body planes. So think of a big piece of plastic coming down and dividing the body into different pieces. So if we have the frontal or coronal plane, it is going to cut the body into the front and the back. So I'm going to go to the next slide so you can see a better picture of that. So this one right here is the frontal. So it's going to divide us into the front and the back. Okay. The transverse plane is going to cut us in half, the top and the bottom. So think of a CT scan. That's exactly what it does. It cuts us in transverse slices up through the body. And then the sagittal plane divides into left and right. So if it's mid-sagittal, it is going to be directly in the middle part of the body, dividing equal parts left and right. But you can have a sagittal plane any part of the body where we're just dividing it into, maybe at the shoulder, it's still sagittal, but we still have left and right there. The other thing, again, we've talked a little bit about was supine and prone. This is a supine position. Prone is when we're face down. Some of the other terms that you're going to hear is sagittal may also be, some people may say lateral, and transverse may be cross-sectional or axial. Okay, so again, frontal, coronal. How I think of that is if I put a crown on, like a tiara on my head, it's going to sit and it's going to divide it into the front and the back. The sagittal plane, again, left and right, mid-sagittal directly into the middle, and the transverse is going to cut us into top and bottom. Some of the other things that are in the chapter that I want you to pick up on page 41, if you have a text, or table 2.1, you need to study that. You need to know what major structures are in the body and what the function of that body system is. You will pick this up a little bit more through the semester, but this chart is very, very important. Hint, hint, hint. Very important, okay? When you go to the next page, it talks about disease transmission. And this is important. I don't care what health profession you're in. You need to know how disease is transmitted. Generally, we have direct transmission, which is a patient-to-patient or person-to-person transmission. We have indirect, that's going to be like us touching something. So touching the exam table or touching a telephone, touching a wheelchair that's been contaminated. Bloodborne, we know, is being in contact with infected blood. The droplet, there is a difference between droplet and airborne. Droplet is like when we cough. It goes out 3 feet, it drops, and then it sits. That's going to be things like the flu. Those are the type of things. I have my students wipe their tables off all the time because what do we do when we have a cold and we come to class? We blow our nose, we do our mountain of tissues, snotty tissues, and then we pick them up and we throw them away. That's indirect, actually, from those sitting there. We can pick that up. But the droplet spreads happens when we cough or we sneeze, and it goes out into the air and then drops down. Airborne is a little bit different. This is how TB is spread. Airborne floats around in the air and then lands on the body or in the lungs, and we pick that up that way. The best way for airborne, again, examples is TB, measles, chickenpox as well. So if you've ever noticed people who are in isolation in the hospital, it's because they're making sure the air is exchanging at a faster rate for those people that have TB to get that airborne pathogen out so they don't have problems. There's also foodborne and waterborne transmission. We call this also the fecal oral route. I mean, think about our migrant workers, guys. They're out there picking fruit and our vegetables, and there are no porta potties. There's nothing. So they go to the bathroom, either urinate or defecate. There's nothing there for them to wash their hands, and then they continue picking our fruit. So this is really easy. Hep A is spread that way, but that's a really easy way to spread bacteria. We also have vector-borne, and vector-bornes are going to be our little critters. Anything like flies, mice, any animals, mosquitoes, those type of things that can transmit disease. Please make sure you're reviewing the types of diseases that are out there. Know what an idiopathic disorder is, what a nosocomial infection. That is something that we pick up in the hospital. That is not good. What's an organic disorder? You need to know those type of terms. Also, congenital disorders. Congenital disorders actually are conditions that are there at the time of birth. These are things that have happened. A developmental disorder, which is a birth defect, can actually be a result of a number of different things. So you just need to read what that congenital disorder is, what a developmental disorder is. Okay. Review the different types of healthcare providers. Know what a general practitioner is, PA, medical assistant, emergency room physicians, nurses. There's a number of different fields that are in there, just so you're aware of them. Last thing, check your abbreviations. I promise you, abbreviations are going to be on every single test. So look over these abbreviations, learn them, because they are fill in the blank questions. I give you a abbreviation and you have to tell me what it is. Or I ask you what the abbreviation for this is, and you need to tell me. Abbreviations are a huge part of medical terminology. You need to know them. So please make sure you're studying them. Hope that helps you. If you have any questions, please email me and I'll be happy to help.